Child psychopathy: understanding, diagnosing, and managing. Child psychopathy is a complex and sensitive topic that has garnered significant attention in recent years. Psychopathy in children is characterized by a range of emotional and behavioral issues, which, if left unchecked, can lead to severe antisocial behavior in adulthood. This video aims to provide a comprehensive overview of child psychopathy, including its defining traits, diagnostic criteria, underlying causes, and strategies for management and intervention. Defining psychopathy in children. Psychopathy is traditionally associated with adults, but research has shown that its traits can manifest in childhood. These traits include: 1. Lack of empathy. Children with psychopathic traits often show a marked inability to understand or share the feelings of others. 2. Shallow emotions. Their emotional responses may appear superficial or insincere. 3. Manipulativeness. They may use deceit and manipulation to achieve their goals. 4. Impulsivity. These children often act without considering the consequences of their actions. 5. Irresponsibility. A disregard for rules and norms is common. Diagnostic criteria. Diagnosing psychopathy in children is challenging due to the overlap with other behavioral disorders, such as conduct disorder, CD, and oppositional defiant disorder, ODD. The Hare Psychopathy Checklist, youth version, is often used to assess psychopathic traits in youths. This checklist evaluates interpersonal, affective, and behavioral aspects, including interpersonal: glibness, superficial charm, grandiose sense of self-worth. Affective: lack of remorse or guilt, shallow affect, callousness, lack of empathy. Lifestyle: need for stimulation, parasitic lifestyle, lack of realistic long-term goals. Antisocial: poor behavioral controls, early behavioral problems, juvenile delinquency. Underlying causes. The development of psychopathy is believed to result from a combination of genetic, biological, and environmental factors. Genetic factors. Research suggests that genetics play a significant role in the development of psychopathic traits. Studies of twins have shown a high heritability rate for traits such as lack of empathy and impulsivity. Biological factors. Neuroimaging studies have identified abnormalities in brain regions associated with emotion regulation, impulse control, and moral reasoning in individuals with psychopathic traits. For example, the amygdala, which plays a key role in processing emotions, often shows reduced activity in psychopathic individuals. Environmental factors. Early life experiences and environmental factors also contribute to the development of psychopathy. Factors such as childhood abuse, neglect, and inconsistent parenting can increase the risk of developing psychopathic traits. Children who are exposed to violent or criminal behavior in the family are also at higher risk. Case study: Davina's journey. To illustrate the complexities of child psychopathy, let's consider the case of Davina, name changed for privacy. Davina, a 10-year-old girl, was referred to a child psychologist due to her increasingly problematic behavior at school and home. She exhibited a lack of remorse for hurting other children, engaged in frequent lying, and showed little regard for roles. Davina's parents described her as a charming and intelligent child who could be manipulated. They recalled instances where Davina would hurt her younger brother and then calmly deny involvement. Despite several attempts at discipline, Davina's behavior only worsened. The psychologist conducted a thorough assessment, including the PCL, and confirmed that Davina exhibited several psychopathic traits. The diagnosis was challenging for her parents to accept, but it provided a starting point for intervention. Managing child psychopathy. Intervening early is crucial in managing psychopathic traits in children. While there is no cure for psychopathy, several strategies can help manage and mitigate its impact. Therapeutic interventions. 1. Cognitive behavioral therapy, CBT. CBT can help children recognize and change problematic thought patterns and behaviors. Techniques such as role-playing and modeling appropriate behavior can be effective. 2. Family therapy. Engaging the entire family in therapy can improve communication and establish consistent disciplinary practices. 3. Emotion regulation training. Teaching children to identify and manage their emotions can help reduce impulsive and aggressive behaviors. Educational interventions. Schools play a vital role in managing child psychopathy. Individualized education plans, IEPs, can be tailored to address specific behavioral issues. Teachers and school counselors can work together to provide a supportive and structured environment. Medication. In some cases, medication may be prescribed to manage co-occurring conditions such as ADHD or severe aggression. However, medication should be used cautiously and as part of a comprehensive treatment plan. The role of parents and caregivers. Parents and caregivers are essential in managing child psychopathy. They must establish clear and consistent rules, provide positive reinforcement for appropriate behavior, and seek professional help when needed. Building a support network. Connecting with other parents and caregivers who face similar challenges can provide emotional support and practical advice. Support groups, both online and in person, can be valuable resources. Self-care for parents. Caring for a child with psychopathic traits can be incredibly demanding and stressful. Parents must prioritize their well-being, seek counseling if necessary, and make time for self-care activities. The importance of early intervention. Early intervention is crucial in managing psychopathic traits in children. The earlier the intervention, the better the chances of mitigating the impact of these traits on the child's life and future. Hope and resilience. Ethan's story. Ethan's story offers a message of hope and resilience. Diagnosed with psychopathic traits at a young age, Ethan's parents worked tirelessly with therapists and educators to provide a supportive and structured environment. Through consistent therapy and positive reinforcement, Ethan learned to manage his emotions and behavior. Today, Ethan is a teenager with a strong support network and a promising future. If you found value in this video, please give it a thumbs up, like and subscribe to support this channel. Please share across social media platforms to reach a wider audience. Research and future directions. Ongoing research into the causes and treatment of child psychopathy is crucial. Advances in neuroscience and genetics may lead to more effective interventions and better outcomes for affected children. Promising areas of research. 1. Neurofeedback. This technique involves training individuals to regulate their brain activity. Preliminary studies suggest that neurofeedback may help improve emotional regulation in children with psychopathic traits. 2. Genetic studies. Understanding the genetic basis of psychopathy can lead to targeted interventions and preventive measures. 3. Longitudinal studies. Tracking children with psychopathic traits over time can provide valuable insights into the progression of the disorder and the effectiveness of various interventions. Child psychopathy is a complex and multifaceted issue that requires a comprehensive and compassionate approach. By understanding the defining traits, diagnostic criteria, underlying causes, and effective management strategies, we can better support affected children and their families. Early intervention, therapeutic support, and a strong support network can make a significant difference in the lives of children with psychopathic traits, offering them hope and a pathway to a better future. Personal reflection. Having worked with children displaying psychopathic traits, I have witnessed the profound challenges faced by these children and their families. One particular case stands out, a young boy named Jake. Despite his difficult behavior, Jake had moments of vulnerability that revealed his desire for connection and understanding. Working with Jake and his family taught me the importance of patience, empathy, and unwavering support. It also reinforced my belief that with the right interventions and a strong support system, even the most challenging behaviors can be managed, providing hope for a brighter future. Long-term outcomes for children with psychopathic traits who receive intervention. Intervention for children with psychopathic traits can significantly influence their long-term outcomes. While psychopathy is a challenging condition to manage, early and consistent intervention can lead to improved social, academic, and behavioral outcomes. Key long-term outcomes for children who receive intervention include 1. Reduced antisocial behavior. Children who receive early intervention often show a decrease in antisocial behaviors such as aggression, lying, and manipulation. This is particularly evident when interventions focus on improving emotional regulation and social skills. 2. Improved emotional regulation. Effective interventions can help children develop better control over their emotions, leading to more appropriate responses to stress and frustration. 3. Enhanced social relationships. Children who undergo therapy often experience improved relationships with peers, family members, and teachers. This is due to increased empathy and better social communication skills. 4. Academic success. Behavioral improvements often translate into better academic performance. Children who are less disruptive and more engaged in the classroom tend to perform better academically. 5. Lower risk of criminal behavior. Early intervention can reduce the likelihood of children developing into adults who engage in criminal behavior. Programs that focus on building moral reasoning and prosocial behaviors are particularly effective. Specific early childhood experiences linked to the development of psychopathic traits. Research has identified several early childhood experiences that are consistently linked to the development of psychopathic traits. These experiences include 1. Childhood abuse and neglect. Children who experience physical, emotional, or sexual abuse are at a higher risk of developing psychopathic traits. Neglect, or the failure to provide necessary care and attention, also contributes to the development of these traits. 2. Inconsistent parenting. Inconsistent discipline and unpredictable parenting can lead to confusion and insecurity in children, fostering traits such as impulsivity and manipulativeness. 3. Exposure to violence. Children who are exposed to domestic violence or growing up in violent neighborhoods are more likely to develop aggressive and callous behaviors. 4. Parental psychopathy. Children of parents with psychopathic traits are at an increased risk of developing similar traits themselves, suggesting a genetic component in addition to environmental factors. 5. Early behavioral problems. Children who exhibit early signs of behavioral issues, such as severe temper tantrums, defiance, and cruelty to animals, are more likely to develop psychopathic traits. Comparison of different therapeutic interventions for managing child psychopathy. Several therapeutic interventions are used to manage child psychopathy, each with varying degrees of effectiveness. The most common interventions include cognitive behavioral therapy, CBT, multisystemic therapy, MST, and parent-child interaction therapy, PCIT. Cognitive behavioral therapy, CBT. Effectiveness. CBT is widely regarded as an effective treatment for children with psychopathic traits. It helps children identify and change negative thought patterns and behaviors. Techniques such as role-playing and social skills training are particularly beneficial for improving empathy and reducing aggressive behavior. Strengths. Teaches practical skills for managing emotions and behaviors. Can be adapted to individual needs. Limitations. Requires consistent participation and commitment. May not address underlying family dynamics contributing to the child's behavior. Multisystemic therapy, MST. Effectiveness. MST is an intensive, family and community-based treatment that has shown success in reducing antisocial behaviors and improving family functioning. It addresses multiple factors contributing to psychopathic traits, including family relationships, school environment, and peer influences. Strengths. Holistic approach that involves the entire family and community. Emphasizes collaboration among therapists, families, and schools. Limitations. High cost and resource intensive. Requires commitment from all family members. Parent-child interaction therapy, PCIT. Effectiveness. PCIT focuses on improving the parent-child relationship and enhancing parenting skills. It has been effective in reducing disruptive behaviors and improving emotional regulation in children. Real-time coaching of parents during interactions with their child helps reinforce positive behaviors and discipline strategies. Strengths: strengthens the parent-child bond. Provides immediate feedback and support to parents. Limitations: requires active parental involvement. May be less effective if parents are unwilling or unable to engage fully. Understanding the long-term outcomes for children with psychopathic traits who receive intervention, identifying specific early childhood experiences linked to the development of these traits, and comparing the effectiveness of different therapeutic interventions are critical steps in addressing child psychopathy. Early and consistent intervention, particularly through evidence-based therapies like CBT, MST, and PCIT, can lead to significant improvements in behavior and emotional regulation, offering hope for a better future for these children and their families. By recognizing the importance of early experiences and choosing the appropriate therapeutic interventions, caregivers and professionals can better support children with psychopathic traits, helping them develop into more empathetic and socially responsible individuals. If you enjoy this video, please give it a thumbs up, like and subscribe to our channel for more self-improvement videos. Comment below to tell us how useful you found this video. Remember to share on various social media platforms to reach a wider audience. Click the notification bell to get notified anytime we post a new video. Thanks for watching, see you in the next video.